The module so far has focused on the 5 big chronic diseases: obesity, cardiovascular disease, diabetes, pulmonary disease and cancer, and their common, shared and potentially modifiable lifestyle-related risk factors, which include physical inactivity, poor nutrition, tobacco consumption and sleep disturbance. The final module of this course will focus on solutions. Chronic diseases are complex, not only in terms of their development, but also in what can be done to reduce their impact on the individual, families and the broader society. Solutions to complex conditions require a systems approach, and this approach goes well beyond the medical model, since our health is determined by the complex interaction of a range of internal and external factors which govern how an individual's genetic makeup is expressed in their environment, especially when the environment changes for the worse. Several key points need to be considered as we try to find solutions for these 5 common chronic conditions, and indeed these principles also apply to all chronic conditions. They include the underlying biological processes which resulted in the problem, the important influence of the environment, the critical life stages which impact most on the gene-environment interaction, and the effectiveness of preventive strategies and treatment interventions. Ultimately, however, the biggest challenge to solutions for chronic diseases is translating knowledge into sustainable programs which enable individuals to take action and also which enable population strategies to improve general health. Solutions for prevention and care interventions should be founded on an appropriate evidence base. Taking the example of diabetes care, the benefits of medical interventions to reduce the risk of serious complications such as kidney failure, blindness and cardiovascular disease have been demonstrated in a number of randomized controlled trials. But challenges remain in implementing this knowledge in the context of a complex health system which may lack coordination, sufficient funding, and well-trained health staff. In addition, access to care may be limited because of expense and lack of universal health coverage. Implementation may also be hampered by the lack of education of the person with diabetes about the benefits of the intervention, and also the lack of a conducive environment to facilitate required behavioural changes. With respect to diabetes prevention, we also have strong randomised control study evidence that lifestyle interventions which improve diet and increase physical activity and result in a modest reduction in weight can prevent the development of diabetes in high-risk individuals. The challenge has been implementing system change to translate this evidence into community-based programs. A systematic approach to diabetes prevention in high-risk individuals requires a number of factors: community education, identifying high-risk individuals, providing the necessary lifestyle intervention programs, and monitoring and evaluation of progress. This in turn requires policies and programs, role delineation with regard to who will be responsible for delivering each of the necessary steps, funding and coordination. Solutions for preventive population strategies to reduce chronic diseases are not only complex but require a long time frame. Tobacco control is arguably the most successful modern preventive public health action. However, to reach where we are today has required concerted action over a 50-year period and has involved community education, protracted legal battles over whether or not smoking is harmful, strong government policies, and at times unpopular legal and regulatory actions. We are currently witnessing similar international debate about applying some of the strategies used in tobacco control to obesity. For example, regulations to restrict advertising of unhealthy food and beverage to children, sponsorship of major sporting events, and taxes to reduce consumption of sugar-sweetened beverages. These interventions require public education and the support of civil society and strong government action which may impact influential corporate interests. So we will now move on to consider in detail the complex challenges of finding solutions to chronic diseases and how these could be brought together in developing a systems approach to address these major chronic diseases and the threat they pose to individuals and population health.